all of you are ambassadors and role models in this whole process in a critical way. HBCUs disproportionately produce the Black doctors and the Black nurses and healthcare workers and public health officials all across the country. And those graduates are far more likely also then to give back to the community and to be providing their expertise and knowledge into underserved communities. Nobody has a bigger interest in putting the pandemic behind us than our communities and our folks. And so what that means then is that we carry a special burden, not only of identifying all the previously existing healthcare disparities that explain much of the disparate impact of the disease on our communities. But we also have to make sure that we work as hard as we can to end this pandemic.
I think the way I like to go about it is transparency. I recently got my Moderna vaccine, and as a lot of people, I did have some side effects, but I try to maintain I would still get it because I've had people in my life personally affected by COVID. I'm doing this so that I can protect you, so I can protect everyone around me that I love and care about.
I've worked at the vaccination clinics and people will come in and say, I'm actually really scared. Have you received it? And I would tell them I have received it. I had very minimal side effects. And it's amazing to see how their disposition changes. And so many people just feel safe when people look like you.
We're gonna have to rebuild trust in communities that have good reason to be suspicious of the medical community. I think all of us are familiar with the historic and in some cases criminal neglect or even abuse that has been visited on African American communities by the medical profession. Michelle and I, we both publicly got vaccinated and made sure it was filmed so that people knew. I think it's important for us, obviously, to give the facts. So, for example, the question of, well, how did the vaccine get produced so quickly? It actually is a testament to modern technology. I would not have predicted us being able to get such an effective set of vaccines this quickly. And for us to now be presented with an opportunity to solve this thing in a serious way and not avail ourselves of that solution, that's a self-inflicted wound that we just can't afford. I hope all of you continue to let your voices be heard, continue to be out there on your campuses and with people you interact with, because we all want to get back to not just normal, but hopefully a better normal where, having gone through this, we now appreciate the degree to which building up our public health infrastructure, making sure that the medical profession is represented with people of color, practitioners who can instill confidence. That's the kind of future that I think we all want to fight for, and you're at the front lines of that. So keep it up.